Dr. Terry Wahls, it's great to connect with you here. You've got an incredible story. So, can you start by telling us about your journey with MS and how the Wahls protocol came to be?
Sure. So I'm an internal medicine physician, and I was practicing. I had a couple kids. Things were going really quite well. And then, literally 24 years ago, out walking with my wife Jackie, a half mile from home, my left leg grows weak. Dragging it, I hobble home. A couple days later, I'm seeing the neurologist. He's telling me this could be bad or really, really bad. And so the next 3 weeks, I go through the workup and I think about the fact that I've had 20 years of worsening electrical face pain that's been diagnosed as trigeminal neuralgia. And so I go, like, I have a progressive neurologic disorder. I don't want to become disabled. So I'm secretly praying for a fatal diagnosis. And 3 weeks later, everything's back, and I hear the words multiple sclerosis. Now, I do my research. I find the best MS center in the country, see their very best physician, take the newest drugs. And 3 years later, I hear tilt, recline, wheelchair. I take mitoxantrone, a form of chemotherapy, does not help. I take Tizabri, the newest biologic, does not help. I'm switched to Cellcept. And then I ask myself a very critical question. Am I doing all that I can? And I'm a physician, I can still read, and I go back to reading the basic science, and I will ultimately start experimenting on myself. And I decide that mitochondrial dysfunction is what's driving disability. And so I start creating a supplement cocktail. Now, before I'd been a physician, I'd been an athlete. I was a national competitor in full contact free sparring. Gave concussions, had a few myself. And so I had continued to work out, although my workouts had kept getting smaller and smaller and smaller and smaller and very tiny, but when I'm in the tilt recline wheelchair. And I discover the Institute for Functional Medicine. I take their course on neuroprotection. I discover a study using electrical stimulation of muscles in people who are paralyzed, who are never going to walk again. And I convinced my physical therapist to give me a test session. It hurts really bad, but when it's over, I feel great. And we add electrical stimulation of muscles to my little itty bitty tiny workouts. And as I mentioned, I discovered the Institute for Functional Medicine. I took their course on neuroprotection. I now had a much longer list of supplements, which I was happy to add. And then I had this big aha. And Brian, I laugh at myself how long it took to have this aha. Like, what if I redesign the paleo diet that I've already been on for 5 years, based on this long list of supplements, if I figured out where they are in the food supply? So that's more research, but I get that figured out. I have this long list of foods that I now have to stress. And I start this new way of eating December 26th of 2007. Now, for your listeners, you should know at that point, it's been years since I could sit up. I'm in a tilt recline wheelchair with my knees higher than my nose. I have another zero gravity chair with my knees higher than my nose, where I staff the resident clinic seeing patients. They see the patients for me. And I have another one at home. That's how I take my meals. I'm sure my family's very nervous I'm going to choke on what I'm eating. I can't go out to restaurants or movies because I can't sit up anymore. I can take a couple steps with 2 walking sticks. I'm beginning to have brain fog, which is why my boss had told me he was setting me to staff the traumatic brain injury clinic. And I was going to see patients without residence, have to examine them, write the notes. And it's like, there's no way in hell I could do that. And he's forcing my hand to accept medical retirement. I was going to have to start this new job in January. So I start this very, very structured paleo diet, December 26th. January comes after this new clinic. The first 2 weeks, I'm just watching from my tilt recline wheelchair. The third week of January, I have to start examining patients. And so Monday, I examine my patients and I write my notes and I come home and I tell Jack, that wasn't too bad. And honey, could I sit in a regular chair for supper? So I sit in a regular chair for supper and it goes okay. That's, a pretty big deal. And, I go back to work, see my patients. So then on Friday, I come home and I say, honey, I think I can do this. And then, my physical therapist said, Terry, you're definitely getting stronger. Let's have you do your exercises 10 minutes twice a day with the current. And that's 15 twice a day, then 20 minutes twice a day, then half an hour twice a day. And then I start walking with walking sticks at the hospital, stunning my colleagues. Like, they haven't seen me do that in 4 years. And then I start walking with one walking stick. And of course, they all think I'm on tizabri. No, no, and I show them my eSTEM device. And then in April, I'm doing little tiny walks in the neighborhood, just a couple blocks. I tell Jackie, I'd really like to try riding my bike, which I've not done in 6 years. And she says, honey, if things keep going well, maybe in the fall we could get the bike out. Well, on Mother's Day, I really want to try riding my bike. And that's just 2 weeks later. And we have an emergency family meeting. She tells my 16-year-old, 6'5" son, Zach, you run alongside on the left. And she tells my 13-year-old daughter, Zebby, you run alongside on the right, and she'll follow. We get in position. Jack gives the all clear signal. I push off and I bike around the block. Now, that big 16-year-old boy, he's crying. Zebby's crying. Jackie's crying. And you could tell when I relive that moment, I still have tears come to my eyes, because most of us with a progressive neurologic disease, we cope by letting go of the future and learn to take each day as it unfolds. And I've been taking every day as it unfolded, not knowing what it meant. But that day when I got on my bike and I biked around the block, I knew what it meant, that the current understanding of secondary progressive multiple sclerosis is incomplete. And who knows how much recovery might be possible. And so every day I biked a little bit more. In October, Jackie comes home and says, honey, I've signed you up for the Courage Ride. We're going to go together. It's 18.5 miles. And of course, at that point, the furthest I'd gone was 8 miles. But we did it. I crossed that finish line. And once again, we're all crying. My kids are crying. I'm crying. The crowd is crying, because it really changes fundamentally how I think about disease and health. It changes the way I practice medicine, and it will change the way the type of research that I do. And I've made it my mission now to teach the public that, yes, there's a lot you can do, to teach clinicians to change their practices, and to do the research that is changing the standard of care, to empower people that, yes, there is always stuff that you can do that will make your life better.
That's an incredible story, Dr. Terry. The December 26th version of you going from that knees above the chin in that zero gravity tilt and space chair, that's where I see so many of my patients. That is, at that moment, they come into my clinic as an OT. I'm working with them and telling them there's hope. And for you to exhibit that from December 26th to Mother's Day and then beyond is incredible.
It certainly, I was always had the belief there was stuff I could do as an athlete. I knew, they kept telling me to not exercise. I sent myself to physical therapy. I'm like, no, I know you got to keep moving. Because at that point, I believed and I accepted that MS is a progressive disorder, and all I could do was to hope to slow the decline. Recovery never entered my mind until I rode around the block. It's like, wait a minute, I think recovery is possible. I'd done all that work just to slow my decline, because I knew recovery wasn't possible. Now I know better.
Good for you. That's incredible. So there's so much to unpack there. So going from not barely being able to feed yourself and barely being able to move and stand up and not being able to stand up to where you are now, and that progression from the guinea pig of yourself and unpacking the supplements and the nutrients. Tell us about the diet. Let's start there.
Yeah. So I had been a low-fat vegetarian diet person since medical school. Actually, I'd become a vegetarian before medical school. Then during medical school, I embraced the low-fat idea, did that. And interestingly enough, my neurologist introduced me to the idea of a paleo diet back in 2002. I'm still walking, although not very well. The next year, I'm not walking. I'm using the tilt recline wheelchair. But it's like, okay, it probably takes a long time to repair all the damage that's happening to my brain and spinal cord. So I was okay with continuing to follow the paleo diet. And then when I decided mitochondria the problem, I added these supplements, still following the paleo diet. So no gluten, no grain, no legumes, no dairy, meat, and vegetables. And then when I decide I really have to ramp up these particular nutrients, and by that time there were 12 that I was really interested in. Then when I first started doing this, I had the long list of here are the foods I got to be eating. Then when I changed how I practiced medicine, and I wanted to teach my veteran patients how to do this in the 5 minutes that I'd have with them when I was staffing the resident clinic, I need to have an easily teachable, memorable way to teach these concepts. And that's where the 9 cups came from. 3 cups of green leafy vegetables, 3 cups of what I call the sulfur-rich cabbage, onion, mushroom family, and then 3 cups of deeply pigmented, like carrots, beets, berries, peppers, things that have color all the way through. And then I preferred that people ate meat, fish, poultry. I also had committed vegetarians, and I was respectful that I needed to have a vegetarian version, so gluten-free grains and legumes for those folks. And I could teach that in 5 minutes, and I would tell briefly my story in about a minute, and that then we'd have 4 minutes to teach the concepts of 9 cups, and say, like, you pick the start date, and next time you come back, let's see how it's going. And so my resident physicians were amazed that I could get these cantankerous veterans to make these really big changes in their diet in less than 5 minutes. They're like, oh my God, they couldn't wait to take me into staff with the patient that they had not been effective for all of their time. And I think it comes down to telling the story and talking about your personal experience. People, they can tell if you're just talking book knowledge or if you're talking personal experience. And so it was very rare I could not get a patient fired up about making improvements to their diet. Now, they may not be ready to do the whole Wahls protocol. And I also said, do the adds first before you do the subtractions. It'll be so much easier. So we talk about the 9 cups of vegetables, plenty of meat. And then the next time when they got that going down, then we go down to, okay, get rid of the sugar, get rid of the gluten, get rid of the dairy, and see how you feel. And do that just as an experiment. And I try to get them to do it as an experiment, ideally for 3 months, but at least for 2 weeks. And depending on the veteran, we sort of negotiate between 2 weeks and 3 months what they fill up to. And often it was super interesting. And I warned them, the first week, you're going to hate me. You think I'm the doctor from hell. You'll have headaches. You'll be irritable. You'll be crabby. You'll be going through withdrawal from the addictive compounds and all that processed foods. And then you'll begin to feel better. And then you'll feel like, okay, I made it 2 weeks. I'm going to go back to my pizza and beer because I really miss it. And then you have the pizza and beer, and wham, your symptoms are back. You feel terrible. And that's when you're like, okay, I think the doc's right. Maybe I really will feel better if I stay with this new way of eating.
That's great. And what I really like about that is it's not a dogmatic. It's not a eat this and you're fine. If you don't eat this, you're doomed. It seems like you really respect that there's not one diet for every person.
Right. It's autonomy. If you stress, here's what you add. And I certainly acknowledge if you want to do the Mediterranean diet and that's what you and your family can do, by all means, do that. If you want to do the low-fat diet, yep, you can do that, but be sure to add all of these vegetables. And if you want to experiment with taking away foods that are most problematic, the fast foods, processed foods, do that at a pace that you can manage. And if you want the next experiment to take gluten and dairy out, do that. I challenge people and encourage them to be the principal investigator of the most important experiment, which is their life. Pay attention to what makes you feel better. Whenever you have a bad day, look back at the previous 24 hours. What was new? Was it a fight with your spouse? A scare with your kids? A financial catastrophe at work or at home? Forest fire that was too close, so air quality went bad. A flood in your house. That you ate pizza and beer after not having done that for a long time. So you'll get clues. And if you'll pay attention to those clues and learn, you will keep making progress on your healing journey.
So you've been a part of an incredible amount of research with MS and these progressive neuromuscular conditions as it relates to a lot of things, but specifically speaking about diets. What have you found to be the best diets and what are the worst?
Yeah. Well, we did something called a network meta-analysis, which is a way to look at all of the randomized studies that used the outcome that you're interested in. So we looked at fatigue, quality of life. We have found 12 diet studies that had been randomized. And then we looked at those outcomes. The process used something called a standardized mean difference. We're able to show that for reducing fatigue, and all the diets that we looked at were anti-inflammation, ketogenic, fasting, calorie restriction, low fat, Mediterranean, Paleolithic, and ketogenic, and of course, usual diet. And then you look at the mean, the standard difference, and then the 95% confidence interval. And if the 95% confidence interval favors the intervention, then you can say, yes, that intervention is good. It's good for that outcome. If the 95% confidence interval slops over to the control diet, then you can't say as confident that this is a good intervention. In that additional research, larger sample size is probably needed to answer that question. So we're able to say that there were 3 diets that are great, that were very helpful for fatigue: the paleo, Mediterranean, low saturated fat. And the paleo diet had about a 40% larger impact, so greater reduction in fatigue than either Mediterranean or low fat. Oh. Then for improving quality of life, and there's physical health and mental health quality of life. There were just 2 diets that were helpful: Paleolithic and Mediterranean. And in this time, the Paleolithic was twice as effective as Mediterranean. However, always, the standard usual diet is terrible. And we know that in other studies that have looked at ultra-processed foods, and those are foods with added sugars, made with white flours to make very tasty cereals, pastas, breads, that make up, I believe, 60 to 7% of the calories for children and adults here in America. Diets rich in those foods have higher rates of schizophrenia, anxiety, depression, Parkinson's, Alzheimer's, multiple sclerosis, and worse outcomes. So if the only intervention that people will do is add more food that isn't ultra processed, more of these radical things known as meat, fish, poultry, vegetables, fruit. And then I would also add in not refined cooking fats. So you have the animal fats, and you have cold expressed oils like extra virgin olive oil. Those are healthy. Once we get into refined fats, you refine them with solvents, and you can't get all the solvents out. And so those solvents are in your fat, the refined cooking oils, refined corn oil, refined soybean oil, cottonseed oil. So you get some solvents in there that are not so good for us. So I'd much rather you have animal fats or not refined, extra virgin olive oil.
And then aside from nutrition, what are some of the other key factors as it relates to just general health and aging with a progressive neuromuscular condition?
Well, you want to address all of the environmental factors that you can, and you want to do it at a pace that you can manage. So, in the very first trial that we did, which was for people with progressive MS, secondary progressive, primary progressive MS, we had them do essentially everything that I did. So we had targeted supplements. We put them on the basically modified paleo diet. We taught them a mantra-based meditation. We had them do some cognitive training as well. And we had them do exercise and electrical stimulation of muscles. So we took these people who were exhausted, who were severely disabled, and we gave them a lot to do. And the amazing thing is they did it. We had 95% adherence to the study diet. We had people exercising 20 minutes a day, another hour to 2 hours of electrical stimulation on top of that. People were meditating, and forgive me, I can't remember how many minutes a day they were doing their meditations and their self-massage, but it's extraordinary. These people actually leaned in and did all of that. In my practice, I want people to address their lifestyle factors at a pace that they can manage. And most people can't add hours of self-care a day. So we just, you start at a pace that's manageable for you. And I invite them to pick the domain where they want to start first. I personally like it when they choose diet, although not everyone's ready to do diet first. Sometimes what they'll do first is their meditation. Sometimes what they'll do first is exercise, general exercise and stretching. Sometimes it's balance training. Sometimes it is paying attention to sleep habits, a consistent time you're getting up in the morning, consistent time going to bed. Over time, people who are most successful will chip away at each of those self-care routines until they are actually managing to improve their self-care and wellness behaviors globally.
Seems like as you've been doing all this, you've turned into a behavioral scientist as well, with knowing what works best and what's able to be carried over.
The Veteran Affairs Hospital pulled me out of primary care because they saw I was doing such amazing things and said, we want to have you create your own clinic, which we did. We called it the Therapeutic Lifestyle Clinic. I worked with the health psychologist, with the dietitians, physical therapist, and we had extraordinary success. And I met with my veterans, group visits, and we ended up creating a new behavior change model called the Wahls behavior change model, which incorporated what I learned from my veterans, from my health psychologists, from the dietitians, from the physical therapists, and of course my own healing journey, that you have to honor self-determination. You have to teach people how to be aware, as I said, the principal investigator of their life, teach them about their biosensors. And I got people to love their pain, to realize that pain can be very helpful to give you feedback. If there's a new pain, a new flare, that's a signal. You can go back and like, okay, what can I learn from that?
That's correct.
And by helping people embrace their symptoms as a biosensor, it changes the relationship to those symptoms. It makes it useful. I tell the story of my trigeminal neuralgia, horrific levels of suffering that I had endured for 27 years. And now I love my trigeminal neuralgia. It is an amazing signal. If my face pain turns on, I can have a conversation with myself and then with my wife to say, what do we think was the trigger? We always have theories. And of course, our theories might be wrong sometimes, but that has taught me a lot about my self-care, about the need to take care of sleep, the need to take care of unresolved conflict. That's a problem. You can't just ignore that. Toxins. Pay attention to air quality. So it's been a very helpful teacher for me. And I've taught my neurologist to think differently about pain, and the conversation that she now has with her patients about what we can learn from whatever symptoms we have.
That's great. Yeah, I write about on my blog a lot about the 6 dimensions of health, as I call them, and I believe you covered them all, and they include the stress management, the socialization, the movement, the sleep, the nutrition. But one thing you mentioned is how important physical movement is, and obviously as we age, it gets to become even more important, especially with the risk of sarcopenia and bone density issues. What are some things that you recommend in terms of physical fitness for this population, especially for those who do not have a background in physical activity?
Well, as people begin to move, we talk about low intensity, moderate intensity, high intensity, and I caution them that when you go see your physical therapist, occupational therapist, and they do the exam, they'll talk with you about and give you your exercise plan. And we're all guessing what's going to be the right plan for you, because I want you to have some low intensity, a lot of stretching and balance work, and moderate intensity, and if you're up to it, some high intensity. But when you're severely disabled, you're in a wheelchair, and I tell them, and I'm going to invite you to correct me if I'm wrong here, that high intensity, if you can't sing or talk, doing that activity, it's high intensity for you.
Yeah, that's
and
great.
so if you cannot sing, but you can talk, then it's moderate intensity. And if you could sing or talk, it's low intensity. So when you're doing your stretching, why don't you sing Row, Row, Row Your Boat or some other silly nursery rhyme song? That's low intensity. And then if you are doing your next more rigorous activity, which might be half sit-ups, half jumping jacks, just moving your arms. And if you can't talk while you're doing that activity, then for you, it's moderate intensity. And the benefit of just reducing that sedentary time, even if you're setting a timer to stand up every half hour and take a few steps, then come back to your chair, even that is very, very powerful. And so I want people to begin paying attention to their stretching and balance work, and begin adding a few more minutes of moderate intensity activity at a pace that they can manage time-wise and that they can manage physically. I also suggest that when you do your little exercise routine, if you're not back to your usual level of energy for you, whatever that is, within 2 to 3 hours, you probably did too much. You need a little smaller dose. If the next day you can't function, you clearly did too much. And the goal is to have a harder day followed by an easier day. And again, to make these changes at a pace that you can manage. I love the idea of step counters if people are taking steps, or to simply note how many minutes of moderate activity they've done every day. And if they have the economic resources to get a wearable that will tell you how many minutes of sedentary, how many minutes of moderate activity or low activity, that's even more ideal. But of course, when I was teaching all this, I was taking care of people in the VA system who didn't have money or living on food stamps. And so I leaned very heavy into, you just do stuff with paper and pencil. The VA started giving out step counters, so that became easier. And then most everybody has smartphones, and so then that becomes easier. The more we can just collect this information behind the scenes, the easier it is for our patients.
That's great. One of the first things I recommend after someone is diagnosed with a condition like this is to one, find a specialist, two is to adopt a protocol similar to the Wahls protocol, or just the Wahls protocol, which has been proven, obviously. And then the third is to get that prescription from the doctor for OT and PT to, at the very least, get the evaluation. And call me biased here, but to get the evaluation and to at least start that discussion about that return to movement and that challenge of that movement as it relates to improving or degrading that process, that prognosis.
Yeah, even if people say like, I just got diagnosed, I'm physically fit, I am healthy, I'm still an athlete. Great. Get evaluated so we can design a program that's going to keep everything working well so you don't have loss, because that's way easier than having to recover from loss. And so there's a little bit of work when people are diagnosed for them to realize, seeing the PT, OT, knowing where you're at, helping design a program that you're going to enjoy that will keep you doing well. Because even if you didn't have MS, you're going to get older. And over the age of 40, we begin losing stuff unless we intentionally, very intentionally, train to make sure that we don't.
So returning to the nutrition for a second, two tools I know that you employ a lot in the Wahls protocol are carbohydrates and fasting. How do you think about them as it relates to these diagnoses?
Well, people are very keen about stem cells. I want to get stem cells to treat my Parkinson's, my Alzheimer's, my MS. And I'm like, why not grow your own? So one of the best things we can do to stimulate stem cells is either fasting strategies or intermittent calorie restriction, so that your body gets a signal there's not enough calories here. So I'm going to do some repair work and maintain what I've got. And during that signal time, I start making more stem cells. And then when I come out of my fasting or my intermittent calorie restriction, if I have a higher protein diet for a few days, those stem cells will go in and will fix me up. And so I personally really like the intermittent calorie restriction 3 to 5 days a month for a couple of months to get started, then 3 to 5 days every other month as a really potent anti-aging strategy, as a potent way to help support the remyelination strategy, to help make it easier for my body to organize and supervise the repair of any myelin degradation that happened because I have a neurologic disease, because I have a mental health issue, or because I'm older than 40. That will happen to all of you, hopefully.
And then can you talk about the role of carbohydrates and how, well, people think sometimes there's too many, sometimes there's too little.
Yeah,
how do you think about these?
So the average Westernized diet has about 300 to 320 grams of carbohydrates. And of that, right now, the majority are ultra-processed, either sugars or flour-based products. In that, dump a lot of glucose into our bloodstream, driving release of lots of insulin and the development of insulin resistance, and increases the rate of obesity, prediabetes, diabetes, fatty liver disease, polycystic ovarian disease, hormonal imbalances. So lots of things that are associated with worse health outcomes. If we come down, the next common diet people hear about is the Mediterranean diet, high in legumes, vegetables, and that has about 125 grams of carbs. Certainly much, much better than the 320 grams of the usual American diet. It has fewer sugars and fewer flour-based products. Then we come down to the paleo diet, as we described it and we've studied it, that has about 80 grams of carbs. And much fewer, much fewer sugars, much fewer flour-based products. Then you come down to a intermittent fasting, and depending on how you do that, on the days that you're fasting, that's going to have considerably fewer carbs. And if you're following your usual diet, you'll have more carbs. And we don't really know what the usual diet range would be. If you do a ketogenic diet, that's about 50 grams of carbs to 30 grams of carbs, depending on which type of ketogenic diet that you're doing. If you do the carnivore diet, which has now also become quite popular, that's going to be fewer carbs still. If you're doing some honey, which people on the carnivore diet do allow, that might still be 20 to 30 grams of carbs. In terms of what my body needs in order to do the biology of being, Dr. Wahls, I need proteins. So, and you can get that from meat, or you can get that from beans and rice. I need fats to make all the fat wrappers or cell membranes. My body can make carbohydrates. I don't have to eat carbs. I could be on a diet without any carbs and still be okay, or have very, very low carbs and still be okay. If I'm on a diet that is exclusively carbs and no fat, I'm going to have a lot more problems with my brain, my myelin, more mental health issues. If I don't have any protein, then I can't make antibodies. I can't do the biology of life. My immune cells will be compromised, and I'll be having to use my own internal proteins, that is my muscles, to run the biology of life, and I'll have much more rapid sarcopenia. But I still want to acknowledge that we are omnivores. We can survive, at least acutely, on a fat-only diet, on a protein-only diet, on a carbohydrate-only diet. And we've had, in the hunter-gatherers, a wide variety of diets ranging from about 80 grams of carbs to zero, because some hunter-gatherers are exclusively meat and animal product consumers. But the average in the hunter-gatherer society is probably 50 to 80 grams.
So you've worked with so many patients over the years, and obviously you've guinea pigged yourself over these decades. Of fun. What is a typical life of yours like now, and how's this changed over the years?
So over the years, one of the things I've noticed for me is I do much better on a lower carb diet. I probably feel the best on 30 to 50 grams of carbs a day. And that's probably because I had early antibiotics as a child. I probably have a yeast overgrowth issue in my gut. And so a lower carb diet that keeps the yeast in check, my mood is just so much better. And I'll tell you my typical day, and I'll tell you what happened this morning. So I get up at 5:30. I did a half-hour meditation. Then I got up and I did, and today was going to be my strength training day. But my daughter and I were having a conversation. She said, let's sort of check your flexibility. So she was showing me her hip release protocol that she's doing for her hip stretching. So I did that with her for 20 minutes instead of my strength workout, and realized, yeah, I really need to work on that hip release. My hips are way too tight. So we're going to make some adjustments to my workout there. Then I did my red light near infrared sauna therapy for that's probably about 40 minutes. Then I did the cold shower, and I'm having tea. I've had tea this morning. I'll have a protein beverage at noon for my lunch. Then this evening, we'll have a bison roast, some yams. I won't have many of the yams. And then a bunch of roast garlic, which I'll have a lot of because I really like the roast garlic. And we have asparagus from our yard, so I'll have a little bit of asparagus. And then I'm going to teach for my Radical Health Upgrade this evening. And I will make sure that I'm in bed. So I'll do another meditation around 9 o'clock, and I'll try to be in bed trying to fall asleep at 9:30.
That sounds like my perfect day. With it. That's incredible. And obviously you said you feel better, you look great. Have you done any testing to see if this protocol and this type of the diet you're on, if that actually affects your body differently? Yeah.
Yeah. What is super fun? I got into thinking that MS in all these neurologic diseases are diseases of accelerated aging. And there are some interesting biomarkers of aging, one of which is telomeres. So I thought, I really ought to check on my telomeres. And I'm getting myself mentally prepared for, okay, do not be too upset if your biologic age is older than your chronologic age, because of course you have a disease of accelerated aging. So you'll just check it a couple times to see how fast you're going downhill. So I get the report back, I'm bracing myself, and my biologic age is 15 years younger than my
Oh,
chronologic age. I thought,
wow.
damn, that's really pretty good. And then, of course, the report was trying to tell me to eat a Mediterranean diet to improve it more thoroughly. I said, okay, no, we're not going to follow your recommendations. I think my recommendations are working pretty well.
Good for you. Good for you. Well, Dr. Terry Wahls, thank you so much for taking the time to speak with me today. Where can people go to learn more about you and the Wahls Protocol?
Yeah, so go to terrywahls.com, Terry, Walls, WAHLS.com. Be sure to sign up for our newsletter so you can hear about the free webinars that we do and the various programs that we offer to teach people how to implement this stuff. Follow me at Dr. Terry Wahls, DrTerrywahls on Instagram. And then on X, it's Terry Wahls. And on Facebook, it's Terry Wahls. And there's a YouTube channel where you get to see some intermittent stuff for me, Terry Wahls MD.
Well, Dr. Terry Wahls, thank you so much. This has been great.
Thank you. Thank you. Thank you. Thank you.